Today we will continue with the discussion on the severity of COVID-19. So in the last video we had discussed about the severity classifications like mild, moderate, severe, very severe, critical. And in critical subtypes like ARDS, sepsis, septic shock. So we discussed till the ARDS. Next about the remaining sepsis. So in sepsis there will be life-threatening organ dysfunction and caused by a dysregulated host response to suspected or proven infection with organ dysfunction. And signs of organ dysfunction include like you can remember like CNS, it affects all the system. So CNS, altered mental status, so you can remember system wise CNS, CVS, respiratory system, GIT, like that, and altered mental status, difficulty in breathing, fast breathing, and low oxygen saturation, decreased urine output, renal, decreased urine output, tachycardia, weak pulse, cold extremities, and decreased BP. Then and there will be loose stools as part of the multi-organ dysfunction, and there will be high laboratory evidence of coagulopathy, thrombocytopenia, and there will be hyperbilirubinemia, thrombocytopenia, acidosis, high lactate, and in children there will be suspected or proven infection and more than or equal to 2 SIRS criteria, of which one must be abnormal temperature or white blood cell count. Next, septic shock. And there will be persisting hypotension, and in spite of the adequate volume restriction, there will be persisting hypotension and require vasopressors for maintaining BP, like mean arterial pressure more than or to maintain mean arterial pressure more than 65 millimeter mercury, and to maintain serum lactate less than 2 millimole per liter. And in children, any hypotension, that is systolic BP less than 5th centile or more than 2 standard deviation below normal for age, or 2 to 3 of the following, that is altered mental state, bradycardia or tachycardia, and heart rate less than 70 per minute or more than 150 per minute, prolonged capillary refill or warm vasodilatation with bounding pulses, tachypnea, motile skin or petechial or purpuric rash, increased lactate, oliguria, hyperthermia or hypothermia. In children, just think of the following, like systolic BP less than 5th centile or more than 2 standard deviation below normal range. And other features as discussed earlier, like altered mental status, bradycardia or tachycardia, that is heart rate less than 90 or more than 160 beats per minute, and that is it is in children, in infants, and less than 70 or more heart rate more than 150 in children. And increased capillary filling time, that is more than 2 seconds, or warm vasodilatation with the bounding pulse, tachypnea, petechia or purpuric rash, mottled skin, increased serum lactate, oliguria, hyperthermia or hypothermia.